debate today, which has come out of Queensland, really started in Queensland, about whether your health staff should be vaccinated. Your medical staff, a Brisbane paramedic exposed patients to measles, wasn't vaccinated. Now, in Victoria, they've decided that future employees of the ambulance service must undergo vaccination, but current ones are not required to. This surprised me. I would have thought that it would be a condition of employment just about anywhere in the health industry that you need to be vaccinated before you dealt with patients. Doctors, nurses, paramedics, midwives. Should it be mandatory? Would you be comfortable? 96900 693 13 13 32. Would you be comfortable if you knew that your doctor or your surgeon, your nurse was not vaccinated? On the line, orthopaedic surgeon Dr. John Cunningham. Good morning.
Good morning, Neil. How are you?
I'm okay. You were surprised this wasn't a condition as well?
I was flummoxed, to be honest. I was flummoxed. It's a question of safety for patients to make sure that the staff that are looking after their children and themselves are protected against some of the most deadly diseases that we're faced with these days. Imagine if you had a child with a compromised immune system and the nurse or the AMBO or whoever, the doctor who was looking after that child, wasn't vaccinated against measles, something that could kill them. It's just ridiculous that the mandatory vaccination isn't a prerequisite, as you say, for employment. It should be just like a truck driver needs a truck license, like a builder needs, safety equipment. Vaccination in the health profession should be regarded as a necessary part of the safety regime in order to come in contact with patients.
What health professionals would you require it of?
I would say anybody that comes in contact with patients. And in that way, people who still refuse to be vaccinated can work in the greater health profession but just not be in contact with patients. And that's how it works in other states as far as I'm aware.
Do surgeons, if a surgeon, for example, tests positive to something like a hepatitis or something like that, are they permitted to operate?
No, we have to take time away from patients until we're cleared. A common scenario is if you have a needle stick injury, where there's potential for an infection from a patient to a doctor, say for HIV or Hep C, then we have to take time away from our practice until such a time that our test results come back negative. Sometimes that's a very short period of time, and sometimes it's a very long period of time.
Has that ever happened to you?
Yes, it has.
So what, did you get a needle stick or something else?
Yes, I did.
And how long did you have to stop operating?
Well, fortunately, it was less than 24 hours. The patient came back as negative for all those bad things, and I was permitted to continue. But it's still a process that you have to go through.
Do you think medical staff would object to it? Not everybody embraces vaccination.
Oh, look, I'm sure there'd be some kickback initially, and I understand one of the union officials for the ambulance service was hesitant about it. I'm not calling for compulsory vaccination. I'm calling for vaccination to be regarded as a prerequisite for employment. So if you want to work in this field, then you have to meet the safety requirements. And of course, it goes hand in hand with an education policy, with proper explanations of the implications for people's decisions. But at the end of the day, I think his name's Mr. McGee, said you might miss out on quality candidates. Well, I would say that someone who refuses to be vaccinated after being educated onto the safety and efficacy of vaccination is not a quality candidate.
They've set up a strange situation here where existing ambulance staff don't have to be vaccinated, but any new ones do. I mean, that's inconsistent.
It is. At least it's a step forward, Neil. At least it's a step in the right direction. Unfortunately, it's not as fast as I'd like to see it. It'd be interesting to find out from the ambulance service if they even keep track of the vaccination status of their workers to see actually how this would affect them. If it's not going to affect their present staff to a great degree, why not just roll it out for all staff from today?
Well, yeah, certainly. Do you think it'd be unreasonable for a patient to ask a doctor whether he'd been vaccinated?
I think it'd be more than reasonable.
They're not very.
Why not?
Well, I remember during the HIV scares that we were told we weren't allowed to ask.
Well, HIV that's a different kettle of fish, and obviously we don't have a vaccination for it. So it's not quite the same. But if I had a child who was sick, I would want to ensure that every member of staff that's treating that child is vaccinated.
Fair point. Thank you for speaking to us. I assume as an orthopod you're a football man, are you?
Go the Hawks.
Go the Hawks. I think you're about to lose. We might sadly be about to lose Chris Judd today.
Yeah, I know that was tragic, and ACL injuries are quite common in footballers, unfortunately, and so are spinal disorders, which is my field. But I think it'll be the end for him, unfortunately. Really,
spinal disorders are common for footballers?
We see one particular condition quite often. It's sort of like a stress fracture at the base of the spine, and it is fairly common.
Thank you very much for your time, Dr. John Cunningham from the Royal Melbourne Hospital, orthopaedic surgeon. Margot, hello.
Oh, hello. Look, I'm just ringing. My daughter's studying occupational therapy, and she's had to have quite a few vaccinations along the way, and she had all the standard ones as a child. She's also had to have, in addition to that, quite a few others.
Does she object to that, or is she happy?
No, she doesn't like needles, but she's happy to, she understands that for the health and safety of everyone involved, which makes me think about people that elect to not have their children vaccinated even at birth if they end up in the health industry caring for others.
Yeah, okay, Margot, fair point. I'd be interested in anybody working in the health industry. Would you object? Do you know anybody who would object? And doctors, would you object if your patient came in and said, excuse me, doctor, before you touch me, have you been vaccinated for all these things? I don't really go down too well with a lot of doctors, but I think most doctors would have been.